So rice now becoming the third most important crop in Kenya. We actually moved to Africa a long time ago. We have started working in Africa since 1960s and 70s when IRRI was established as its headquarters in the Philippines. And from that time, we are actually interacting with our partners here in the region, basically sharing germplasm, sharing varieties, helping with training. At that time, as you know, IRRI is the center that was able to help the Green Revolution to become a reality in Asia. And we are trying to do that here also in Africa. The reason for all these changes and the focus on Africa is mainly we found that rice is becoming strategic, is becoming very important, is becoming a commercial crop, and also the countries, all the countries in the region are paying a lot of money. More than $300 million are paid annually for imported rice just in East and South Africa. Across sub-Saharan Africa, it is costing close to about $6.4 billion a year to import rice from Asia, where the region really have all resources. We have plenty of land. We have more than 330 million hectares in sub-Saharan Africa that is suitable for rice. We are using only 12 million hectares of it. And also yields are very low. We are now bringing that 62 years of experience of IRRI in Asia to Africa to really try to cover this gap in production and reduce the import, because that money is important for many essential things here in the region, particularly for education, for infrastructure, for health, and other things. This is the goal we are working forward to. For most countries in the region, they have sufficient resources to produce their own rice, whatever they need. Especially expanding in land, we have to improve our irrigation system. We have to put very good policies that support farmers in a way that they get more money from their production. We have to reduce the value chains and make it more efficient. We have to adopt good quality varieties that compete with the imported rice, so people shift from imported rice to locally produced rice. Unfortunately, with the poor processing, poor harvest, and post-harvest, poor system, the quality of our local rice is not competitive. And that is why still people prefer rice coming from Asia, especially aromatic rice. But there is no reason why we should not produce here. Moya right now is producing a variety called Basmati 370. This is one of the highest quality rice in the world. But it is old. It is actually released in 1958, but it's still using it. We need to replace that. This variety has low yield, but good quality, but there is varieties that with the same quality that can produce 7 tons. So you can see you can go from 2 to 7 tons just by changing the variety. So we are hoping that the government will help us, work with us closely, where they can at least enforce good policies that can help us develop and release varieties as quickly as possible, and also encourage engagement of the private sector. This is very important because public sector normally has not enough capacity to produce good quality seeds that reach the farmers. They can produce the early generation seeds, and then we have to engage private sector to produce these quality seeds. Private sector have to provide input, especially chemicals, fertilizers, and other agrochemicals. They have to provide mechanization and services. And also they should be engaged even in the value chain where they can purchase, support rice production from farmer groups, purchase that rice, clean it well, dry it, package it, and market it with farmers.
Kenyan farmers and Kenyans have been affected a lot by COVID. We've suffered issues of job loss. A lot of businesses, small enterprises have been affected. And now with this recent war, the Russian war as it's called, of course it's going to affect us negatively because most of our fertilizers come from that country. And now we're trying to increase the inputs in the rice production system, and one of those inputs is fertilizer. So when the fertilizer supply chain is affected, therefore it will also impact negatively on the production chain of rice. So we're hoping this war ends soonest. But in the meanwhile, the government has been putting structures in place, like we have the Baraka fertilizer. So we're trying to now manufacture our own fertilizers here. And because of this war, we'll have no choice but have more fertilizer produced in the country so we can stop this over-dependency of importation of fertilizer into the country. We also import from Tanzania and other countries like that are quite close by, but most of it comes from Russia. So we're not feeling it yet, but it has really impacted negatively. Like this year, those farmers who planted following our CAOP, Kenya Agricultural Observatory platform, who planted when the rains were starting, for example, in Western, they planted maize and beans with fertilizer that was costing 6,000. Now, through the government intervention, it has come down to 3. 6,000 is high. That's double. Does this mean that the price of maize and beans is going to increase by double from 3 to 6? I don't think so. The challenge to the rice farmers is to request them to adopt the rice production technologies, all of them. Don't leave any, adopt them. When you adopt them, then you'll see a marked increased production and productivity. And our technologies are affordable. The other thing, the call to the rice production farmers, use those plant clinics with our plant doctors that have been trained, they have been examined. They're here to serve you, not only for pests and diseases, but even nutritional issues in the rice production system and any other aspects in rice. When you go to the doctors, once they have it, if they can't, we have referral centers. There's one in Kalro Kabete that will serve you and respond to you immediately. Because remember, plant clinic is just the same as a people clinic. When you go to the doctor to be treated, you don't go there and the doctor tells you funny things, you don't know, whatever. So when you go to the plant doctors, they serve you, photograph the specimen, and tell you exactly how to manage that. Those are the things we're trying to get the rice production farmers go and visit these plant clinics. There are many now, they're all over the country, and we have the specific ones in the rice production system.